You know, in medicine, you've got your sledgehammers, tools that are powerful but kind of blunt. And then you've got your scalpels. Today, we're talking about a scalpel, a drug designed for one very, very specific job: jacking up blood pressure without making the heart go crazy. We're talking about phenylephrine.
Okay, so imagine this. You've got a patient whose blood pressure is just plummeting, it's in the tank. But at the same time, their heart is already racing, they're tachycardic. Now, if you give them a standard pressor, you might just push that heart rate right over the edge into a deadly rhythm. So that's the puzzle, right? How do you fix the pressure problem without creating a heart rate catastrophe?
Well, this is a job for a specialist, not a jack of all trades. And that's where phenylephrine comes in. You might also know it as neosifrin. This is the precision tool that's built to solve this exact problem. It separates the job of raising pressure from the job of stimulating the heart.
So what's its secret? What gives this drug this incredible, unique ability? Well, it all comes down to what it is and how it's classified. Let's dive in and see what makes it such a specialist.
Phenylephrine is what we call a pure alpha-1 adrenergic agonist. I know it's a total mouthful, but the name literally tells you everything you need to know. Agonist just means it turns something on, and alpha-1 tells us exactly what it turns on. These tiny little receptors that are found almost exclusively on the muscles lining our blood vessels. It is super, super targeted.
And this is where you can really see the difference. Most other common vasopressors, yeah, they squeeze the blood vessels, but they also give the heart a direct kick, telling it to beat faster and harder. Phenylephrine is different. It's laser-focused on just one job, the squeeze. It is specifically designed to leave the heart muscle alone.
So let's talk about that squeeze. How does it actually work? The easiest way to think about it is like a garden hose. What happens when you put your thumb over the end? Whoosh! The pressure of the water shooting out goes way up. Phenylephrine does exactly that, but to our entire circulatory system. So here's how that cascade happens. The drug latches onto those alpha-1 receptors. That's the signal for all those little muscles in the blood vessels to tighten up, causing this widespread vasoconstriction. That's our squeeze. This squeeze increases the overall resistance in the whole system, which directly makes both the top and bottom blood pressure numbers go up. But, and this is super important, the body has sensors that feel this sudden pressure spike, and they can send a signal back to the heart saying, whoa, 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 slow down. This is called reflex bradycardia, and it is a critical side effect you have to anticipate.
Okay, so now that we know how it works, when do you actually reach for this specialist tool? Well, like any specialized tool, it really shines in a few very specific situations where its unique profile is a huge advantage. Its prime-time use case is for hypotension that's caused by vasodilation, basically when the blood vessels are way too relaxed and floppy, like in some types of shock. And, as we've been saying, it is the perfect choice when a fast heart rate is already part of the problem. Oh, and here's a fun fact. You've probably used it yourself. As a nasal decongestant, it works on the exact same principle. It just squeezes those swollen blood vessels in your nose on a much smaller scale.
Of course, anything this powerful has to be handled with some serious respect. Its greatest strength, that intense system-wide squeeze, is also where the danger can be if you're not careful. So let's open up the operating manual.
Which leads us to the obvious question, right? What's the catch? What are the potential downsides of putting such a powerful squeeze on the entire circulatory system?
First, let's talk about the absolute no-goes, the hard stops. If a patient is allergic, obviously, that's out. If they already have really severe high blood pressure, you definitely don't want to pour fuel on that fire. And it's also avoided in a particularly dangerous heart rhythm called ventricular tachycardia.
Okay, next up are the use with caution scenarios. For a heart that's already weak, like in severe coronary artery disease, making it pump against a system that's been squeezed super tight can be really dangerous. We call this increased afterload. And then there's a huge one for anybody administering an IV. This drug is a beast. If it leaks out of the vein, what we call extravasation, it can clamp down on the blood vessels in the surrounding tissue and cause serious damage.
The potential side effects all stem directly from what it does. It's pretty easy to overshoot your target and cause dangerous hypertension. That reflex bradycardia we mentioned, sometimes it can become way too strong. And if that systemic squeeze is too intense for too long, you can actually start to cut off blood flow or perfusion to vital organs like the kidneys.
All right, that was a lot. So let's boil it all down to what really matters when you're out in the field. What are the absolute must-know bottom line takeaways?
If you remember only one single thing, remember this number, 0. That's the number of beta receptors, the ones on the heart that control how fast and how hard it beats, that phenylephrine directly stimulates. 0. Its action is pure, unadulterated alpha.
So here it is, your mental checklist. Number 1. This is your go-to when a patient is hypotensive and tachycardic. Number 2. Pure alpha means pure pressure with no direct heart rate increase. 3. You've got to titrate this carefully and watch that blood pressure like a hawk so you don't overshoot. 4. Make absolutely sure that IV is secure. You do not want this leaking into the tissue. And 5. Don't forget the heart rate might actually drop, and that drop can be pretty significant.
And all of this brings us back to that final thought, a question that really gets to the heart of emergency medicine. We love our versatile, jack-of-all-trades tools. But some crises demand a specialist. And understanding when to deploy that one perfect precision tool, well, that's what separates good care from truly great care. It's knowing exactly when you need the scalpel, not the sledgehammer.